Hi, my name is Dr. Michael McKinley from Progressive Physical Therapy and Rehabilitation. Headaches are a symptom that we treat a lot in our office, and it's not something that gets treated quite a bit by physical therapists. So let's talk a little bit about where we get headaches, where they can originate from, and where a physical therapist like myself can help, and then some of the places that we can't help. So in physical therapy, we're basically dealing with tension type headaches. So tension type headaches are typically tightness in the muscles, and muscles called suboccipitals. They're very small muscles, and they attach to the base of the skull and to the top of the neck, also known as the cervical spine. So if you hear the word cervical spine just means neck. So since the word cervical starts with the letter C, our very first bone here we would call C1, C2, and so on and so forth as we go down. So you have a small muscle that connects from your C1 to the base of your skull, another muscle that attaches to C2 to the base of the skull. And when these muscles get very tight, they create compression on the nervous system as it exits out of the spine. And when that occurs, that can create tension headaches at the base of our skull. So if you ever feel like you get that headache at the base of the skull or kind of in the back part of your head, it's typically coming from a compression of muscles on the top. If C1 is compressed far enough forward, and this typically we're going to see in patients who have a forward head or their chin is kind of jutting out, and we put excessive pressure here. When the first cervical, or again that C1 joint, has too much pressure on it, it will radiate or cause pain behind the eye. So when patients say, I have a headache, but it's really like this pain behind my eye, it's originating from the first cervical vertebrae. If you have extra compression at your C2 vertebrae, it's typically over here, almost like where your sunglasses or your glass arms would be. And so if you get a headache that seems like it's coming from here, a lot of times that can come from our second cervical vertebrae. These things are easily treated in physical therapy if they're identified. So a lot of times we work on posture, trying to take the head and driving it up. Sometimes we even have to start in the mid-back, because if the mid-back is slouching forward, we can drive the spine up, driving the head back and opening this space, reducing the tension at the bottom, and then taking pressure off of these two individual joints that can lead to different headaches that you might be complaining about. Tension headaches can lead to migraines. So migraines in general are something that physical therapy is not really going to be very successful at treating. So migraines are when people have an aura, difficulty seeing bright lights, or difficulty with noise, intense night headaches. These are migraines, typically treated with medication. But what we do know is that a tension headache can lead into a migraine. So if you're a patient who feels like my neck gets really tight, it gets worse as the day goes on, and then I have difficulty with bright lights, loud noise, auras, or I just feel like I just want to close my eyes, a lot of times that's a tension headache leading into a migraine. If we can reduce the tension headaches, sometimes we can eliminate migraines completely, or a lot of times we just reduce the frequency of intense migraines. There are varieties of different treatments, but I suggest you give us a call at Progressive Physical Therapy and Rehabilitation, and we can discuss and evaluate what's causing your headaches and if we can or cannot help you.